Good evening, everyone, and welcome to this edition of the Benjamin Rush Institute virtual event series. My name is Cleumy Gama. I'm the medical student at Liberty University College of Osteopathic Medicine. I'll be your host for this evening's program. Our program today is a little different, a little special. We have two panelists tonight. We have Dr. Schmale and Dr. Flo. Dr. Flo is currently completing his residency training in psychiatry at St. Louis University. He's a graduate of St. Louis University, where he obtained his doctorate of medicine. While in medical school, he founded his school's Benjamin Rush Institute chapter, acted as a BRI intern, and helped to create the BRI podcast, Next Generation Medicine. Dr. Schmale is a primary care physician in Sheridan, Indiana. He graduated from Marian University College of Osteopathic Medicine in Indianapolis. He's board certified in family medicine and sports medicine. Dr. Schmale is also the founder and president of the BRI chapter of his school and is now district president for the Indiana State Medical Association. Today, we have a very special week for us medical students. It's match week, and we thought it was appropriate to talk about match and residency. So that's the topic of our virtual event series tonight. So gentlemen, thank you so much for joining us. And here we have a few questions. The first of all, and hopefully the most simple, what is match week? What is match week? When does it happen in the fourth year of a medical student's career? And how does it happen?
You want to take it first, John?
Well, it's I don't know if I have the best answer for that. I mean, it's just the match week just being the week that they announce, well, first of all, whether you matched or not, and then if you didn't match, you have given the opportunity to go through the SOAP match, which is like a secondary process. So apart from that, though, I don't know what else goes into the whole match week. And then match day later on is when they decide, or they announce like where you're matched at. So that's a separate day.
Yeah, and for us, for this year, this Monday was the beginning of match week, when all of the medical students were figuring out where they matched, whether they matched or not, what they're going to do. And tomorrow, what a big day when we find out where. So I don't know how long ago it was for the both of you guys. It's going to be next year for me. And just what a week.
It's very exciting.
Yeah.
So one of the big topics that we had for today was, what are some strategies on helping secure a residency slot? We talked to medical students, we talked to pre-med students, and this is just the biggest thing, the big deal for medical students. What are we going to do for residency? And where am I going? So are there such things as proven strategies, or how to portray yourself to secure a residency slot?
So for me, we at Marian, we were inaugural school, and so being in the first class, when we started getting into the process of like doing the applications for the match, we had someone that came and discussed various strategies. I think getting everything all out there in the open. Board scores are going to be important, whether we like to think that or not. It's an easy way to objectively stratify applicants for positions, especially competitive positions. So upfront, board scores are going to be important. Now, they don't guarantee you a spot, but they're going to be important in looking at applicants. Letters of recommendation. Everyone's going to have letters of recommendation, but I think the important thing is going to be having program directors for different residency programs is going to be important. Having really high up or well-known or well-respected physicians writing letters of recommendations. Those are going to be important. Your personal statement, and making sure that your personal statement is specific to the program and or specialty that you're applying to. I think those things right there are going to make a big part of your application. And then I think being on the other side of it in fellowship, where we were interviewing candidates for fellowship, all the extracurricular activities are going to be another important aspect. whether that's research papers, whether that is volunteering your time at a food pantry, doing, sideline coverage for sports medicine, working at a charity. Those things are all going to be important. And if you can focus those things on the specific area of medicine that you're interested in getting into, that is going to help that much more. I think those are kind of the main things from what I saw on the other side when we were helping figure out what residents or applicants we wanted for our program in residency and then also fellowship.
Yeah, and I'll add a few things to that, just kind of from my experience, because number one, I think it's surprising the number of people who don't actually submit a complete application. I was talking with some people on the on this side of the match process, and if you don't have all your all your board exams taken or all your letters of recommendation submitted or your complete information provided, like don't do that. don't shoot yourself in the foot. You have to actually show up and follow the the guidelines and then submit everything that's needed. So first and foremost, make sure you just are organized enough to get that done. When it comes to the personal statement, I thought that was kind of interesting because, yeah, it's we're not all excellent writers. We go through science and math, and a lot of us don't get a lot of exposure to literature, and it can be hard to know that balance between brevity, but also giving enough details to make your statement stand out and be a little bit unique. So just rules of thumb, though, probably shouldn't be over a page long. All these programs, they're not going to want to read multiple pages from multiple, thousands of applicants. And it needs to, yeah, be very specific. So all these generic things that people write, cliche, statements. Some of it's kind of impossible to get away from, but just be genuine to yourself and what you want to go into. Showing that genuine interest has to come out through that letter. And kind of like on the other side of that spectrum, like I said, like most people aren't excellent writers. If you are, great, but what you don't want is a terribly written letter. So in some ways, it's better to have a very average personal statement that's clear and with good grammar than trying so hard to be so stand out with your letter that you end up making a bunch of errors and it sounds kind of sloppy. So don't stand out for bad reasons, stand out for good reasons, or kind of hide in the middle. Make sure you have a complete application. With the letters of recommendation, that's going to matter a lot, especially as kind of test scores become more pass fail, or programs take different stances on how much to emphasize those scores for whatever reason. So your letters have to be pretty specific. Like, try to find people that know you and can actually give specific examples about what you've done and your interest, and how you would be an excellent physician in that specialty. Yeah, I mean, as far as just like what you're submitting to the programs, those things are just the essentials. Like, you got to do those things well. But we can talk more about kind of how to choose a program, and when you're in the interview process, kind of how to present yourself and how to go from there.
Well, those are awesome advice. I think a few things that we have touched on and we just want to expand. We talk about competitive specialties. We talk about how to make yourself look competitive. What does that mean for you? Because we talked about extracurriculars, research, volunteering. Those are all such, like, how to use that. Is that a way of using such extracurriculars to make yourself look competitive? Is there a proper way without being too pushy that it seems fake?
In my opinion, so all those things are going to be important. I think where you're going to maybe excel compared to other candidates is if you are focusing specifically, like doing research projects or articles, or volunteering your time in an area of medicine that you're trying to get into. If in your personal statement you're talking about how you want to do family medicine, or you want to do sports medicine or psychiatry, and then all your research, all your charity work is done, in neurology, or doing OB stuff, that kind of brings red flags to people that are, looking at your application. Like, why are you focusing on these things when you're trying to get into this specific specialty or program? That's just my take on it.
Yeah, I mean, I my first thought was that extracurriculars, having them is better than not having them, and even if they're not directly related. But yeah, obviously, if you have extracurriculars involved in the specialty of your choice, that's going to be awesome. But people change their mind, and all the med students I talk to, at least in their third year, are always like, I don't know what I want to do, and they're open to everything, which is probably true at the beginning. But I think, yeah, I mean, a lot of this to make yourself more competitive, the more you can know about yourself and what you actually want to do, the better you're going to be at communicating why you should be in that field and can do well in that field. So unfortunately, if you're somebody who struggles between 3, 4 different specialties and you can't really pin it down and you don't really have a geographic region that you want to go to, and you have too many interests, it's just too broad, you're going to struggle, I think, to like really make it specific and powerful. You can still do it for sure, but I just find kind of as a rule of thumb, like if you know what you want to do and you've taken steps to pursue it already, you've done extracurriculars that make sense, you've done research that makes sense, you have letters of recommendation from people in that field that can speak specifically to that. I mean, that's how you really set yourself up for success.
I think we just got a question from the audience. I think that's a really, really nice question. We can understand how to get professors to write your letter of recommendation. This seems straightforward. But how do we get program directors to write your letter, and how to build a meaningful relationship with directors or deans that they may write you such letter?
So there are a lot of medical schools that have residency programs affiliated with them as well. And so if you're interested in family medicine and there's a family medicine program associated with your medical school or a hospital that you're in quite often, I think reaching out to that program director and letting them know you're interested in family medicine, if you are going to be doing a rotation there for family medicine, the more you can talk with that program director and get him to understand, why you're interested in family medicine, and asking about, different opportunities that you could do to volunteer your time. It's going to be those things. The more time you can be in front of those program directors, I think the better. Now, but you don't want to come over the top though, and they know you want to, get a letter a lot of the time, and you just have to be genuine about what you're doing as well.
Well said. I think, Dr. Flo, you briefly touched on something that I would like to expand on that now. How to choose, or perhaps even how to research residency programs, whether you're in the process of, I'm not sure what I want to do, I'm still exploring, or I am set on psychiatry. Where do I go as a medical student to, okay, where do I find the residencies? Where are they?
Sure. Yeah, I think, yeah, it's a great question. Just kind of how do you explore? And I mean, a lot can be done with Google. But I mean, so I guess one place to start is, yeah, as far as picking specialties, well, yeah, that's just going to come in third year through experience. And but one thing as far as like picking programs, so then you can go to online and search for, like I'm in psychiatry, so psychiatric programs across the country. You'll get a list through like your program as you're going through the match process and looking through that information. Or you could go to like the boards, like the board of psychiatry and neurology. So like, and it's same for fellowships. If you're looking for a specific fellowship, you can Google like some sort of credentialing board, and then they'll show their list of different programs across the country. But with regard to how do you choose a program, this year I've spoke with a lot of med students, and I think, yeah, there's different ways to think through it. One of the things for me, like when my decision-making process when I was a fourth year, was definitely practical. I'm from the St. Louis area. My wife's from the St. Louis area. We're recently married and had started having kids right away. So it's like, you just need to be close to family. Like it's just, you got to. Otherwise, it's just going to be 10 times harder than it needs to be. So for us, it was pretty clear, and I was thankful to have good options in the St. Louis area. But I think you can get a really great training in so many different areas of the country and different programs. You don't have to go to the top 10 programs to be a great doctor. So at some point, it kind of, for me, kind of have to weigh the pros and cons and kind of do a little bit of planning for like, where are you going to be in 10 years, 20 years? And that might change. But, if you really want to push for, if you want to be an academic physician, it's going to really matter a lot to be in a research institution. It's going to expose you to better research opportunities and people that are going down that pipeline, and they can really mentor you. But if you have really no interest in participating in research and you wanted just the practical hands-on clinical training, you have a lot more options, I think, and you can kind of pick more geographically based on preference of where you want to be, whether it be based on finances or family or whatever it might be. One thing I've come to appreciate more about being in an academic institution, even though I don't want to do research personally, is like, it is helpful though, as you're learning a specialty, to kind of know what is coming down the pipeline in this specialty. Like for psychiatry, I think it's important to know, like, what are the novel treatments coming out? Where are they available? What are people talking about? Just so that when I get out there to practice, I'm not only using like the first generation antipsychotics and antidepressants. I know second, third, whatever, and kind of, the novel treatments, and kind of have them in my arsenal, so I can bring that to my patients. So one thing you could do is look at the programs geographically or otherwise, kind of get your first filter through, and then look at their programs and kind of look at the research they're doing. Whether you want to do research or not, just kind of see what their kind of areas of interest are, and which of their faculty members are really active, and if it's something that's interesting to you or not. And I find that to be helpful even before you've made a decision of specialty. Like for me, I was between like general medicine and psychiatry, and I just found myself really fascinated by the more nuanced things in psychiatry and the newer treatments coming out, and those things seem to be sparking a lot of interest. So as far as picking a specialty and then also then picking a program, kind of what are they doing, and is that something that you want to participate in? I think that has been helpful to kind of see what people are up to at those programs, and that also gives you stuff to talk about when you're on interviews, and like, oh, I'm interested in this program for this reason. I see this research going on, and I know this faculty member is active in this area, and that's an interest of mine, and that all just sounds really good whenever you can come to the table with that information.
There's always so many things that you guys are talking about, and you bring so many other questions. I'm trying to stay organized and follow a little bit of a pattern. I just can't help. I don't know if this is something that's more important or significant for a specialty such as family medicine, but there's big talk of opposed versus unopposed program. What does that mean, and what are the pros and cons of one versus the other? Or are they really that big of a deal? Or is it just something that's on Reddit, it's online, and we talk about it and make a bigger deal than what it is? Or is there actually significant differences between such programs?
So I can speak. So my program was an opposed program. There was a transitional year and then an internal medicine program at my hospital in family medicine. But it's a good question. I think it comes down to, specifically in family medicine, what are you wanting to do after you finish residency? Do you want to be in a rural area and do a little bit of everything? Then going to unopposed program is going to be important, because you're going to have lots of opportunities to deliver babies. You're going to do a lot of internal medicine and critical care medicine. You're going to do a lot of outpatient and inpatient medicine. So you get experience doing a little bit of everything, and then you can kind of focus in on the areas that you really enjoy the most. The benefit of being at a opposed program is that, like for me, I am not the biggest fan of inpatient medicine. So when we had to do our inpatient months, we had other internal medicine residents that we could work with and shoot ideas off of, and it cut down on the amount of, overall through my residency, how many inpatient medicine rotations I had throughout my program. And so it was beneficial in that sense, and I didn't have to take call for the hospital all the time, because there were inpatient or there were internal medicine residents as well in transitional years. So there are benefits both ways. I think it really depends on what you see yourself or what you're wanting to do after residency. For me, I wanted to focus more specifically on outpatient medicine and sports medicine, and so I was going to get that through my program, even though it was opposed, but it was opposed in a way that I liked because I didn't have to do as much internal medicine. Now, I did a lot of OB because we didn't have any OB residents, but that, that's part of family medicine as well. And I don't know if I say that I really enjoyed OB, but I got good experience doing it.
Yeah, I was talking to a physician the other day, and I asked, like, oh, did you enjoy your residency program? And he told me, you're not supposed to enjoy residency. You're supposed to get through. So, and I can see how there's different things like, yeah, it's opposed, but it worked out my way. In the end of the day, I enjoyed it. It wasn't a bad thing after all. I think another important question we have here, in retrospect, what do you wish you knew about the match process when you were MS3, MS4?
I don't know. It's such a mysterious process. I mean, there's like, I don't think there's much of a way to like game the system or anything. It's just, I don't know. It's an algorithmic thing that you make your list and kind of see what happens. I don't know, Dr. Schmale, if you have other thoughts.
Yeah, I'm kind of with you. The process is the process. You can't really game it. You can maybe think of ways to game it, but you really can't. It's all going to come down to your application and your interview, and then based off how well you think everything went and what programs you really like the most. I mean, it's ranking those at the top of your list, and then kind of going from there, hoping for the best and trusting the process.
Try trusting the process. I think I hear that so much now.
One little additional piece. I don't know if every program had this available to them or not. Maybe everyone does, but at SLU we had a program, like a supervisor that talked us through like how many programs to rank, and it was like kind of based on the statistics, like based on your board scores and your overall performance academically. They kind of gave you a ballpark. Like if you apply to 20 programs, you have an 85% chance of matching, and then you go up from there. And so it's kind of how comfortable are you? It was at the time when we were applying, it was like expensive to apply to so many because you had to travel if you got invites. So I was trying to find the right balance between applying to enough to ensure with reasonable certainty that I'd get it accepted, but not bankrupt myself. So if people don't know about that or have access to that, it's worth looking into and asking your program administrators about it, see if it's something that you can discuss.
Yeah, I guess since in the topic of ranking, what is this ranked list? How do we make one, and what are important things for you as a student doctor looking into residency? How to wisely choose the programs that you rank? I guess we briefly mentioned how many to rank, how to make that decision, but what are other factors that go into the ranked list?
Yeah, there's a lot. I mean, briefly, just like things that we talked about, like how to choose programs, like geographically, or if you really want a specific program or a specific type of program, like academics versus community or something like that. You have all these programs that you could choose from. You kind of start to narrow it down, and then what it comes down to for me anyway was, okay, so I've got maybe 5 programs that I really are taking seriously, couple locally, a couple more distant, and have to really pull me away from my area to rank higher. And then you go on interviews. So then you start asking specific questions about the programs. And I mean, I think it's really important to ask about, the call schedule, the hourly kind of workload demands, kind of information about caps of patient loads and how much supervision there is early on versus how much autonomy there is. And didactics are didactics. I don't know, you could ask residents about what their like feeling is about how good the didactics are, et cetera, like elective opportunities and just getting exposure to different clinical settings and things like that are important. There's a lot that goes into it, but at the end of the day, a lot of those, kind of the first 2 for me were like really clear, and then the last the bottom of the list were pretty clear, but everything in the middle, it could have been shuffled in any random, orientation, and it would have been fine. I mean, about the same.
I think you touched on something that's quite important for us to talk about. Like you found your specialty. I want to do XYZ. Now I'm going to apply to them, and I was invited for an interview. How do I prepare for that? And what type of questions do I bring with me? What are the things that I want to know about a program before really considering going there, outside of geographical space, like location? I have family here. It's like all of this is just so convenient. But what are good things to ask about the residence life? I think you touched on a few of them, Dr. Flo, now, but what else could we expand on that if possible, for the students that watch us, that listen to us, for guidance?
I think other things is how is clinic flow going to go there at the program as an intern? How many patients do you start off seeing in clinic versus as a third year? What electives are available to the program? What other things? So in family medicine, I was interested in doing sports, and that is ultrasound heavy as well now. And is there access to an ultrasound that I can use to see patients in clinic? Are there high schools that I can cover for, kind of padding my resume then for sports fellowship? Looking into your program ahead of time is going to be important. And, when you do that, you can maybe see some minor differences during interviews, and then really asking those questions, to find out, okay, so it says you have ultrasound access. What does that mean? Does that mean, you have one didactic, every year on ultrasound and that is it? Or, is there an ultrasound in your clinic? And every time you're in clinic, if you think that an ultrasound is necessary, you can go get it, and you can do it. And it's going to be kind of finding out those details. And I think that is what is going to help in the grand scheme of making your rank list as well. Okay, what checked all the boxes at each program, and what checked the most boxes as far as location and electives and overall quality of life at the program and all those things. But definitely recommend looking into the programs more when you do get that interview, so you can have more personal questions to ask. And like John was saying earlier, what faculty do they have there? Are they doing any research that you're specifically interested in? And that looks great when you bring that up in an interview, especially if you're interviewing with that person. Even better, it really gets you to be very memorable in the interview, and allow faculty that are making these decisions on where they're going to rank applicants. It really helps.
We just got a really interesting question from the chat that I'd like to read for you guys. We're talking about interviewing and extracurricular. So this question is, most of my extracurricular activities are with a conservative political group. How do I talk about my involvement without letting that affect my application?
Yeah, I mean, this was one thing for me that came up because most of my extracurriculars were with Benjamin Rush, which is, obviously not like explicitly a conservative group, but if people Google it, you find out that it's free market oriented, free enterprise oriented, and that's gonna, some people just don't understand what that even means. Some people will be a little bit off put by that, whatever. So the approach that I took was that first of all, most of the people I spoke to weren't really familiar with Benjamin Rush. So I just said things like, yeah, it's an educational nonprofit, and it gave me the opportunity to learn about economics and like healthcare economics, healthcare policy, even discuss healthcare ethics. Like all those things are true and really good. Outside things, kind of tangential, tangentially related to medicine. They're on the fringe, not like directly patient care or clinical oriented, but really important. And they come up all the time, especially for me going into psychiatry. Like the ethical questions get brought up all the time, and it was a good thing to have that to talk about. And it's a leadership opportunity, and it just shows outside interest. I think it's a good way to show that you're a well-rounded individual. If people, if they I don't know. Like, I guess I have to think out loud if they brought up specific concerns about like a political orientation or anything like that. If I don't think that anybody asked me any. I don't actually think it would be appropriate for them to ask you about your political actual opinions on the interview trail. It might be evident, but I don't know that. Yeah, nobody asked me like personal questions where I felt uncomfortable. I think for me, most of the people just wanted to know why it was something that I enjoyed and what it meant to me and what kind of leadership opportunities it kind of opened up. And I think there was definitely a lot of interest in like, oh, you were involved in this organization and you went to these conferences and you did this fellowship and etc. So yeah, I don't know. Those are my first thoughts. I don't know. Trey, if you have anything else.
I know I agree with everything John just said. I would say to add on to that, if you are asked more about it, I think everyone knows there's problems in healthcare, and it doesn't matter what perspective you look at it from. I think most people can generally point out all the same problems. And, Benjamin Rush, what it helped me do was kind of learn solutions to some of those problems. Now whether everyone agrees with those solutions, at least you're looking at this from a big picture perspective and being able to give an educated take on, how we could figure out those solutions to the problems. And so in family medicine, direct primary care, learning about that in Benjamin Rush, I think was huge. And this is a free market solution to, a problem of rising prices and quality of medicine and healthcare. And so being able to elaborate on something like direct primary care or other just general applications of the free market of medicine, like, now you have the Oklahoma Surgery Center and, applying it to surgery, or there's now ERs that do similar things. Being able to have knowledge about these things and, it shows that, okay, yes, we may not agree 100% on everything, but he's actually thought through these things. He makes some really good points, and maybe I'm interested in that too. Maybe he'd be a great person to have in our program to be able to educate me more about some of these things, or to get his take on other things. And like John was saying, it feels like it makes you a more well-rounded person, in that while you do enjoy medicine and you do enjoy family medicine or psychiatry or ortho or something like that, you do have other extracurricular interests as well. And I think that's important.
I think another question just popped up from the chat, and I think love to hear what you guys have to say about this. I'm a MS4 and I'm finishing my degree this spring. I plan on applying for residency this summer and next academic year. Does this hurt my chances since I did not start the process as a third-year medical student? And what can I do now to be more competitive?
I think it depends on why you're taking the time. I don't think it necessarily is going to cause any problems, but let's see, I took a year off in the middle of med school, and it wasn't for like a research year or anything like that. So it's all about what you're doing with your time, and why you're taking the time off. And you just have to be kind of honest about that. If it, for whatever personal reasons or academic reasons or whatever, just need a break, that's fine. I mean, you just got to explain that and then fill that time with really good stuff. You could use that time to shadow, get more experience, do research, work. I mean, you can bring all that to the table. So I don't think it necessarily is a bad thing. It just depends on why you're taking the time and what you do with your time.
Yeah, I would agree. Now it's definitely going to get brought up if you have a gap in your just regular timeline of medical school. But if you can say that, well, during this time and this time I was, working at this clinic, or I was doing this, and this, being able to apply my clinical skills I learned in medical school, or my knowledge that I've learned through medical school, and elaborate on that, I think it's not going to hurt at all. I was this was a question that I figured may get asked, and I didn't have a good answer specifically, but then if there was a test score that was maybe a concern, to retake the step 3, just to show that I still have all the academic and, clinical knowledge to pass this test, and maybe you did better on it the second time than you did the first time. Like, that would show that you're still interested and wanting to apply yourself, and that you still have everything you've taken out of medical school.
Mhm.
And on the topic of, sorry, go ahead.
No, please go ahead.
I was gonna say, on the topic of hard questions, Trent, we should share some of our hard questions from the interview trail. I think there's one that stands out to me, and like just like questions to be prepared for. You should definitely have answers to these things. I didn't have an answer, and I looked like a buffoon. So, okay, so I'll just. All right, so I was at this interview, and hey, it's a really basic question. Like, you should definitely anticipate these questions. So they're like, tell an example of a time whenever you made a mistake and how did you resolve it? And like, I just could not think, and obviously I've made mistakes, but I couldn't think of a good example of a good mistake, or a good example of a mistake that I made where I had a good reaction and like learned from it or something. But they want to see like you have acknowledge that you make mistakes and learn from them. So like, that's a good question to prepare for. Just kind of have something in mind ready to go for that one.
Yeah, so those type of questions, and there's lots of variations of that question as well, and they do get asked in interviews, and being able to have something in your mind right away. So I would say definitely prepare for your interviews, like, pre-plan or come up with ideas about questions exactly like John said, so you can have an answer when it's asked, and you're not having to take a bunch of time. But also in the interview, I mean, if you have to take 15, 20 seconds to think about it, I mean, the interview, that is not a problem. The interview understands that you want to make sure that you have a legitimate answer, and you're not just kind of BSing the rest of the interview.
Is it a type of thing of like, yes, I've made mistakes, I don't know what type of mistakes do I let you know? Is it like that bad of a mistake, or like, how can I make a mistake look good? Like, it wasn't that big of a mistake, but I did it.
Right. Yeah. No, you don't want to say something like, my weakness. Like, I guess the basic question is like, what's one of your weaknesses? You don't want to say like, your weakness is I'm too humble, or I'm too caring, or these things. It's just like, just something that you've actually struggled with and that you learned from. Like, it's kind of just good to be reflective, and yeah, what are your strengths, and then also to complement that, like, what's something you've struggled through, like a challenge. It's good to be prepared for those things. I will say too, this is more when I was applying to med school, but you don't want to over prepare. So this is like a tricky situation where you want to be prepared, you want to have some thoughts in place, but you don't want to have every question calculated and have a perfect answer pre-planned. You want it to feel like a conversation. You want to be genuine and share your thoughts, and take a time, take time, take a breath, and think about how you want to answer and say what's on your mind. But at one interview, I was told that I was too prepared.
It's funny how in medical school, like, something we worry to be too prepared. I have a good friend that he always jokes like, for my weakness is leg day, and I just always thought it was so funny. I don't think it's applicable to answer that in a residency interview. To say the leg day is one of your weaknesses that you're working on. But talking about mistakes and weaknesses, I think it's important that we touch at least something. What are such things as a red flag in your application? We briefly mentioned like a gap year or a failed test. What is considered a red flag, and what is a good way to address them in the process of either applying, interviewing, and all of this?
I think like a failed class would be another thing. If you had to retake a class during medical school, any like criminal activity would probably be a red flag. Those are the things that come to my head first on the topic. But I would say don't try to hide it, because they will, they're going to look into things, and if they find it and you don't bring it up and they know, to them that's another red flag. So address it by bringing it up first and saying, I failed. And if that's in your personal statement, if it is, in the interview, if they ask any question like, is there anything concerning that you want me to know about you, or do you feel like was going on a tangent. With that said, if you can bring it up first and have it like a prepared answer ahead of time, it's really nice. And like, so if you fail the class, just say, explain exactly why you failed the class. Maybe you were busy, being involved in a couple other groups at that time. You were the president of the Benjamin Rush Institute, or you were the president of another organization, and there were 3 events that month, and you weren't able to study for a test. Own it wholeheartedly and say, I wasn't able to study. I retook the class. I passed the class, no problems afterwards. My board exams showed that I excelled in these areas. But own it and don't try to hide it in your application, because that's going to be a major red flag on top of it.
Mm-hmm. I think.
Yeah, I was going to say another red flag, because it's relevant to my program, was or will be moving forward. If you change your mind and switch residencies or switch programs, you should have a reason for that. We had a situation where someone switched between, I think, looking in retrospect, they had switched between like surgery and then went to neurology and then they went to psychiatry. And so when you see a lot of switches, like big switches, those are not easy switches.
Yeah.
To switch programs or switch specialties, have a meaningful reason. And you're going to have to do a little bit of work to convince them that you're actually committed and like this is going to be it moving forward. Because we unfortunately had a resident leave in the middle of the year, and it's so disruptive to everyone's workflow. So for programs that have experienced that in the past, they're going to be extra sensitive to that if there's big switches like that. So just have something, be committed and explain what's going on. And it actually could be a strength, like, well, I switched from this specialty to that specialty because I realized through this process that I really love this, specialty instead. And so you could work with it for sure, but just be ready.
Yeah, I'm glad you brought it up. That was actually the next question that I was gonna ask. It's not something that's talked about, maybe because it's not something that you idealize, going through 2 different residencies. I did that and then I switched to that. But maybe it's just also some things that medical students may not know. Well, what if I thought so highly of specialty XYZ and now I'm there? I thought that's what I wanted, but oh my goodness, it is not. That's not what I thought. Am I stuck, or is it possible to switch residencies? Not that that's the ideal, but do you have to finish and switch? Like, is that a possibility? How does that work?
Yeah, you sure can. You can switch. We had a good example of someone who switched from OBGYN to psychiatry. He was a great resident and did really well. Just after his first year, he was like, yeah, this is not what I want to do. And then he came over. And then we had a bad experience. So you can. I don't know the exact process. I guess you just go through the match process again. You have to go through interviews and applications and all that.
Hopefully it's not something that we are looking forward to, but I guess it's important to know that there's a possibility if that is the case. I think as we're about to close our time, we have 2 big questions now, and we can spend the remaining of our 12 minutes or so. And what are tips for life during residency, and what are tips for life after residency? So if we can start with during residency, what would you both say are tips how to prepare for now? Congrats, you're an intern. Well, what do you do now? How's everyone talks about the steep learning curve, like how to survive in residency?
As far as how to survive, first off, figure out a good work-life balance. Find activities that are going to be able to help you relieve stress in a productive, healthy way, because you're going to be working quite a bit and it's going to be really tough. And if you have a good outlet that you can do when you're not working to help clear your mind, that's going to be huge. Aside from like that, as far as like being ready for your clinicals and everything, have a couple resources at hand that you feel like you can trust. If that's up to date, if that's a specific like pocketbook that has a bunch of, clinical exams or everyday medications, something like that you can turn to if you feel like you're like in a pinch and you need to look at something. And your attendees are going to realize you're still in training, and part of residency is learning to become a physician. And just because you have finished medical school does not mean you're just done and you know everything now. And they realize that, and they understand that you may not have the answer every time. And so you don't stress if you don't know something. This is a time that you need to be learning, and if you don't know something, make sure you're speaking up.
Yeah, those are great points, and I'm gonna go over those same ones just with a little twist on my end. So yeah, the work-life balance is so key. Because residency is hard no matter what you go into, no matter what program you go into. And so everyone's gonna reach a point where they're kind of having that burnout phase, or they're like second guessing doing any of this. I mean, I had that moment. It's like, why am I even doing this, working so hard? I'm not even feeling like this is rewarding, especially the first year, because there's a lot of busy work that goes into it, and you're just like every day kind of initially struggling to figure out, how do I do my job? And it doesn't feel like you're doing medicine. It feels like you're just pressing buttons on the computer and running around and just kind of confused a lot and stressed. And that was true for me staying at the place where I was at med school. So like there's just it is a big transition. So having that work-life balance to where you have a healthy outlet to relax or burn off some stress or anger, frustration, relationships outside of the program that you can kind of be distracted a little bit, get out of medicine for a little bit. Obviously, I already mentioned family. Like if you have a family, or if you're married or have kids, being close to them. Which, a side note, that's why I'm wearing glasses right now, because my kids have blessed me with both pink eye and a cold. So sometimes the family causes more problems, but having that distraction is really helpful overall. It's a really healthy thing. But if you don't have that, then just you have to have friends, that community outside. I would say, if you go to a program and you get along with the people there, you're going to do better, because you're not going to get burnt out as much. You're not going to be as resentful. You're going to have better communication, and you're not going to assume that like you're working harder than everyone else as often. Everybody feels that way sometimes. It's like, I feel like I'm taking on all the work, and then that can lead to some really dark, thoughts of just like resentment and anger and kind of just burnt out qualities. So you want a good connection with your people at work, but you do also need those healthy outlets outside of work. And if you can get that established, like in fourth year with like healthy hobbies and healthy work-life balance, exercise routine, nutrition, if you can get some of that stuff straightened out before you start, you'll be in good shape. And then, preparing, when we have interns come in, we don't expect them to really know anything. We just show them how to do the job, and it's the expectations, at least in psychiatry, have been very low. Like, because I don't know for your med school experience, but psychiatry is a very brief block. And so when you get into the workflow, it's just like, man, it's a lot to learn. So learning where to go for answers, and like how to navigate the literature. Have a good couple of resources. UpToDate's fine. For psychiatry, obviously the DSM-5, and every specialty probably has their little handbook, but just know how to navigate it. Look through it before you start, and know how to answer questions, and then how to use like Google Scholar and how to use PubMed, just kind of because you're going to be given presentations, you're going to be looking up weird case presentations and things like that. So just a couple of resources, not too much. So just those things for sure, but there's probably more.
That's nice. I think it's important we also talk about like we're dedicating our lives how to take care of other people, and sometimes I guess it's easy for us to forget how to take care of ourselves, especially during residency. I'm sure when you get so busy. And I guess now for us to wrap it up this great time, what are some tips or advice or how to enjoy now life after residency? Is there light at the end of this long tunnel?
Yes.
Thank you for letting us all
know. So I think, things to do, I think, you can also do them in residency, but I think things that are important are, it's always going to be important to have like disability. And these are not like sexy things to talk about, but things that you should start considering: having like a life insurance policy, especially if you have a family, having disability insurance, meeting with either an attorney to go over like physician contracts, meeting with a financial advisor to make sure that everything is in line and that you're setting yourself up for success long term. I think those are all important things to start looking into, and you can do some of those things in residency. And if you do them earlier, then you can even get better deals because you're still younger as far as insurance is concerned. But I think doing all those things are important. And being able to talk with other physicians that maybe are out in practice and kind of getting their take on what to expect, and what life is like. I mean, in residency, while I saw a lot of patients, applying it to real life, there's a lot more patients that you're seeing and a lot more paperwork, and there is a lot of work with it. But you don't have to talk with an attending before you make any decision, or code a certain way, or do this or that. So it is really nice. It's nice to be able to finally settle down, and I don't have to change my work location every month at a different clinical, doing something different. It's the same thing, just about the same thing every day most of the time, and it's nice to be able to finally settle down. But I would say it's going to be important to get some of those other like non-sexy things out of the way first, to make sure you're setting yourself up for success long term, because part of being a physician is the quality of life. I mean, some physicians work a lot more. Part of the reason I went into family medicine is I could have a really good quality of life. I can work 4 days a week, see patients in an outpatient setting, and then I can come home to my wife and kids and be able to go to their sporting events or extracurricular activities. And it's really nice. And it's something I hadn't really got to do all of medical school and residency and then fellowship. So things are good.
Yeah, I look forward to all those things. 2 more months. Yeah, I think, but yeah, those things are not sexy, but they are so important. And I think for me, I learned a lot about the financial stuff from White Coat Investor. If no one's heard of that, that's a really helpful resource. I have a podcast and a bunch of online stuff. But yeah, I mean, we work so hard to get to this point. You want to make sure it's worth it, and I hate to be the one who says you have to wait just a little bit longer, but like after residency, it's still an important time to be really responsible. Give yourself a pay raise, but like set up your retirement accounts, get your insurance stuff figured out, and really start that process, because that money needs to work for you. It's going to take a couple of decades to really turn into something really, really valuable. So it's got to be sustainable, but it will work out, and you just need a little bit of structure. So whether you want to do that on your own or get a financial advisor, just got to get that stuff figured out. But it's very exciting to know that you can like craft your clinic how you want to practice. I mean, I look forward to that too. It's just I'm also going to hopefully work like 4 days a week, and then use that 5th day to do like transcranial magnetic stimulation, which is like a newer treatment in psychiatry, or see private practice patients, slowly start building a clinic, and you can start doing those things. And so using right now, it's kind of my time to start networking. So reaching out to the community and building those networks, because in residency, you have a built-in kind of community, but when you get out, unless you're in an academic setting or a larger group practice, there can be a risk of like isolation, and then that can be kind of a lonely place to be. So kind of thinking about that, what is your professional community going to look like? Is it going to be a bunch of independent practitioners that are kind of teamed up, or is it going to be a big practice or an academic center? But just kind of, especially early career, I would recommend, and this is what I'm pursuing, is making sure you have an actual academic community where you can kind of bounce ideas off and make sure you're doing the right thing, and discuss cases and not feel alone. Long term, I would love to have a private practice. I'm going to work toward that probably, but right after residency, I think that's going to be important, just to kind of keep that community going.
Oh, that's awesome. And as we close, would you guys like to have any closing comments or advice? Perhaps like focusing now on our students who are just coming out of the match week and tomorrow going to open the envelope and figure out where they're going. But what advice do you guys have?
enjoy the next few months. Have fun, go on a trip, do something fun.
Agreed. Between medical school and residency, and then I think residency and starting your practice, there's not going to be many opportunities where you won't have anything to do for a period of time. And so use that month or a few weeks to just do something that you can just take your mind off medicine altogether and just do something you really enjoy, because you're not going to have many opportunities like that until retirement, pretty much.
Well, thank you so much, gentlemen. Thank you, Dr. Flo, Dr. Schmale, and thank you for everyone that have been in attendance, for watching us. I want to be respectful of both of y'all's time. If the students have any questions, this has been recorded. It's going to be posted on YouTube for other students to watch for future years, where they can just take in y'all's advice. I think that has been very valuable. It has personally been very valuable to me, as I'm going to be walking this road soon enough. It's going to be before I know, for sure be coming back for the notes I've taken and rewatching this sometime soon. So, gentlemen, thank you so much for joining us. And with that, we conclude our virtual event series.
Yeah, thanks for having us.
Thanks for having us. Take care.
Bye-bye.